Hey there, it's Dr. Sarah. Today on the She Found Motherhood podcast, I'm chatting with Cait, and she's sharing her birth stories with us. Baby number 1 was an epidural birth in the hospital, and baby number 2 was a home birth. She shares both those stories and talks about how different they were. She also openly shares about the challenges of postpartum. If you're pregnant and wanting to prepare for postpartum, then you should definitely check out our Pregnancy to Parenthood online prenatal masterclass. Not only do we cover what to expect in the weeks leading up to delivery and the birth experience itself, but we also talk a lot about how to prepare for postpartum and what to expect. Check it out at www.shefoundhealth.ca/masterclass.
Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, two doctor moms who are creating a community rich with high quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the 4th trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood, or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners.
She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated.
Cait, welcome to the She Found Motherhood podcast. We're so excited to have you share your birth stories with us.
Thank you. I'm so excited to share them with you and everyone else too. They were such great experiences, and very different.
Awesome. Okay.
Yeah.
Here. We were chatting before, thought we would talk about both births because they were both very different, and then you can compare them. So why don't you start by telling us about your pregnancy and delivery with your oldest guy, Ryder?
Yeah. So both my pregnancies were actually very similar. I was so sick with them. I had HG, so hyperemesis, that whole vomiting throughout the entire pregnancy, which is not fun. And everyone calls it morning sickness. Nobody talks about how it can last for days and days and days. So it basically went into my 3rd trimester with both pregnancies, medication, all of that. It was a lot worse with Ryder. I was hospitalized quite a bit for fluids and things like that. And, but other than that, the pregnancies were easy in the term that nothing intense, drastic went off, no high blood pressure issues, no issues that would put me in detriment or the babes, So the pregnancy, they were long, but it was worth it.
I know, right? I'm like, it's actually 10 months.
Yeah.
So tell us about your delivery with Ryder. Did you go into labor on your own? Did you need an induction?
So, Ryder's birth. Oh my goodness. So I was about 7 days overdue. On the induction list was praying to every being of a God energy that he would just get out of me. And I ended up going into labor with him so unprepared for being overdue. The contractions hit, I remember, during watching Jeopardy, and I was in complete denial. I was refusing that they were contractions. I was brushing my teeth and getting ready for bed and no, I'm fine. My hospital bag was not even packed.
And you were overdue?
This is my life. I remember sitting in the nursery crying in between contractions, packing my hospital bag with the most irrelevant things Friends DVDs. Why? I don't know. And then finally went to the hospital and Yeah, so he was a hospital birth and got there. Everything was good. It was actually quite different. I just remember that I had a hymenal septum intact with him.
Oh, okay.
So I was going to actually have surgery to remove it pre-labor, but it was just too painful.
Mhm.
I couldn't even get numbed without it killing me. So they gave me an epidural before the normal time that you would get an epidural, because they actually did like snipped it and stitched me in labor.
Okay.
Got the epidural, got that, and then the goal was that I would deliver him vaginally, and instead of, you know, him coming out and that tearing, because it's basically like a band across your cervix, right? And it being an uncontrolled bleed, that it would be a lot smoother to do it that way. So a little bit of a hiccup, but not bad. And you know, 12-hour labor for first baby, not too shabby.
Okay.
In and out, again, was in complete denial when the nurses came in and was like, "You're ready for a baby?" And I'm like, "No, I don't think I am." Like, you go on a break and I'll check in with you a little later. They're like, "No, dear, the baby needs to come down." So yeah, I think it was an hour of pushing and he was out.
Good. Yeah.
Yeah, super easy delivery with him in terms of, you know, compared to difficult ones. Yeah, so that was how little Ryder was born, like almost 7 years ago now.
Crazy, hey?
Yeah.
And how was your like postpartum and breastfeeding experience with him?
So he was a very difficult baby, and in difficult I mean he had undiagnosed acid reflux. He was a little bit underweight, wouldn't eat, like just everything that, you know, for a first time mom could be devastating came at me. He would not latch. He was screaming nonstop. For the first like 12 hours in the hospital, they had to cup feed him. So basically like get colostrum out of my breasts and then put it in a little like medicine cup and try and get that into him, because he just wouldn't take anything. And that was because of the acid reflux that was undiagnosed. He was just in so much pain. Yeah, so it was difficult. I think we spent three days in the hospital, and then we self-discharged AMA, like against medical advice, because we were like, we need our own setup here to try and figure this out on our own. And then yeah, it was a lot. The colic, I think I developed severe postpartum depression and anxiety from that. Like it was a fog. It was such a fog, and no one really prepares you for what to do with those type of babies, right? Because no one talks about that. There was no instant connection with him. Nothing. When he was born and they put him on me, I was like, okay, you can take him off now.
Yeah, and that happens, and that's okay.
Yeah.
Right? But when you're not prepared for that,
yeah, you instantly feel like a failure, right? Because you expect this like rush of endorphins and this, oh my gosh, I love you. Whereas I was like, no, I don't like this. I don't want to feel this way. I think I went to sleep like post delivery. I think I slept for like 3 hours, and he just snuggled with his father because I was so tired and just not there at all.
Yeah, and that happens, right? And that's okay.
Yeah.
But if you don't know that it's okay, and if you don't expect it, it can be really distressing.
It is. Yeah, exactly. Like that's something that, you know, anyone who talks to me about birth or postpartum, it's like, it's gonna be fine if you don't feel that instant, you know, like there's so much going on. And I think it's the movies that, you know, almost romanticize birth. Yeah. Where this beautiful baby comes out and you feel loved and it's all wrapped in this cute blanket, and, you know, and that's not realistic all the time.
No.
So yeah, there was a lot of struggles with him being, I think I was 21 at the time, you know, you're not as aware, you don't have the skills really to advocate for yourself. So it was a really dark time, and it's crazy looking back on it now, but I mean, it definitely prepared me for my second baby, because I knew so much more.
Yeah. So not so bad that you wouldn't do it again, right?
Not so bad that I wouldn't do it again. Yeah. It took a little bit. There was a little bit of space between the two.
That's okay. So you had Rome almost 9 years ago, right?
Yes.
So tell us about Rome.
Oh,
And I
we
know a little
froze.
bit. Cait and I actually work together. I know a little bit of the story, but I would love for you to tell everybody in detail because I'm excited to hear about this experience.
Yeah. So, oh my gosh, this experience, it's so funny because if it wasn't for the pandemic that we're in right now, I probably never would have had a home birth. And I am absolutely addicted. I used to roll my eyes at people that were like, I had a home birth. Okay.
I love you,
But
Cait.
let me tell you, it was crazy. So Rome came one day before his due date. And there was just something in me that like I knew he was going to come that day. It was a week before I was having constant like contractions that would start and they would hit and they would, be frequent and then they would stop. And it was like 8 hours of, this and then stop. And I remember being on the phone to my midwives and I'm like, something is wrong with my body. I don't think I'm going to be able to go into labor because again, no one tells you that that's normal. And even if they do, you're not going to listen to them because you're like, no, this is not how it's supposed to be.
Yeah. Cause we have an idea of how we want things to go.
Exactly. Yeah. So I was done. I was so tired. I think I begged for like 2 to 3 membrane sweeps to try and just get him out. And it wasn't even his due date, but I was done.
Hey, Sarah.
Yes, Alicia.
Do you ever find that people bring in their birth plans to show you in the office and they're not even hitting the important points?
I do. And I think that they don't even consider all the options when really we often don't have any idea of what to expect going into labor.
Agreed. So what we did was we put together a free birth plan download, but we also put together a little course about how you can fill it out, talking about what the real purpose of a birth plan should be and how it can really help you have the best birth you can.
We've got an area that covers your medical history and your pregnancy, and then we've got a section that helps you walk through and figure out when you might accept certain interventions. Not just yes or no, but at what point and at what stage in your labor and birth experience.
We go over some examples through case studies to help you get an idea of what this could look like. And we also think it's really important to use your birth plan as a jumping off point for conversations with your partner and your provider. And we talk a little bit about how you can start doing this with our birth plan course.
Absolutely. If you're interested in learning more, head to our website, www.shefoundhealth.com/courses.
See you there.
So yeah, that Friday we went out to dinner and I kind of made a joke like, oh, this is our last meal before baby. And let me tell you, I ordered everything that I probably shouldn't have ordered. I like Virgin Caesar, extra spicy, like oysters, extra hot sauce. I was getting this baby out.
Yeah.
And so we were driving home and we were going to go on like this nice long walk by the harbor. And I got this like contraction out of nowhere. And it was like a different feeling. And my partner was like, oh, like we should probably go for a walk around the house. And I'm like, no, like, let's just go for a walk. And he's like, yeah, we're going to drive home.
Yeah.
Thank God he didn't listen to me because from the time that first contraction started, I made it up. We got home. I made it up the driveway, probably about 500 meters down our road. And I was like kneeling over in pain. Like I was like, this is happening now. Like, and so we made it back to the house. And so I guess what is that like golden rule? I forget it now. When you're supposed to call
like
your medical provider.
5-3-1 or something like that. I can't remember. I never use it either.
Yeah, it's something like, a certain time apart. You got to be in labor for an hour. I remember that.
Yeah.
And then they have to be a certain amount of time.
Contractions like a minimum of 5 minutes apart lasting.
Yeah, something like that. So I remember thinking that and I'm like, this feels different. Like something's wrong here. So we get inside, we call our doula. I had like a birth photographer set up, like just everything that I thought was going to happen. Call our doula. She's on the way. Mike goes upstairs to do God knows what. And I'm on the stairs, like thinking about his murder because I don't know what he's doing, but I'm dying.
Yeah.
And it's
He's
about
not there
me
with you.
right now.
Yeah.
I was going to kill him. So he comes down the stairs and I just like scream at him to get me upstairs. I'm like knelt over. It's only been like 30 minutes and it's progressing so quickly. And I'm like, you gotta call the midwife. Like, you have to call her. So we phone her and she was about 30 minutes from our house. She can hear me, like we're on speakerphone.
Yeah.
And she's like, oh my gosh, like I'm on my way. I'm coming now. Yeah. Like, get her in the bathtub, you know, try and like help relax. And she's like, call me if she feels like she has to push, call me back, but I'm on the way. So we get in the tub and it's like another 10 minutes go by and I'm like losing my mind. I am so uncomfortable. My legs are like restless. I could not sit still. Just like a squirmy person in this tub. And I'm like, you have to phone her back. So Mike calls her back and she's like, okay, tell me what's going on. I'm like, there's so much pressure. I like need to push. I can't, like, I can't right now. And she's like, I don't want to freak you guys out, but Mike, you might need to call the fire department to come and until I get there. Like, I'm trying to get there as fast as I can. And his face was like sheet white. Like, this is his first baby. He is like, oh my gosh, this is not happening.
Yeah.
So he's panicking and I'm just like in the tub the entire time waiting for the midwife and the doula to get to our house. He is looking at the camera on our phone at the driveway, just staring at it. Like
waiting for them
white,
here?
Watching for headlights. And I'm like, hello, not paying attention to me. He is just staring at this camera. So I was like, oh my gosh, everyone ends up showing up at once. Of course, she actually called a midwife who lived closer to the house to try and intercept because they were so worried I was going to be giving birth so quickly. Yeah. Everyone shows up, everyone comes upstairs. I kick Mike the heck out of the room. I'm like, get out. Like, your energy is like, just leave. And then it was, I think the whole thing was an hour and 23 minutes. Wow. And he was out. It was crazy. It was just such a bizarre experience. Poor Michael. He was just, I remember him coming back into the room, sitting on like the ledge and then going to sit on the toilet and trying to like, you know, give me space. Yeah. And then next thing I knew, I'm in so much pain trying to push this baby out. And the first birth, having an epidural, I didn't know what to expect. And oh my gosh, that pain, it's like something takes over your body, but the relief when it's done, I remember them being like, we can see the head, you're so close. And I'm like, if you can see the head, pull it out. Like, get him out of me. Actually, we didn't know it was a boy or a girl even at that point, but yeah, it was such a relief, like that feeling of just, you know, being done. And then they put him on me. And again, it's not like the movies, like he wasn't lifted up and it wasn't like, it's a boy. I think it took us like a full 60 seconds to be like, wait, what is it? Yeah. What did we just have? And then I was like, I can feel like he is definitely a boy. This is the boy. Yeah. So yeah. And then they gave me a shot of the
oxytocin.
They gave me the shot of the oxytocin and I was still in the tub. They took baby, one midwife checked him over, and then I tried to deliver the placenta and it just like was not. I was having such a time. It took me an hour to get it out. It was like I was exhausted. It was like trying to push out another baby. Like, again, you don't think about those things with Ryder. Again, like with the epidural, I honestly feel like the placenta just slid out because I don't really remember feeling much, but it was like pushing. I got on the bed. It was like on all fours again, trying to get this thing out. I kept being like, you know, I need a break. We need to stop, putting baby on me, trying to like, you know, get some contractions going still. And all that stuff. Yeah. But once it was out, it was lovely. I instantly got in the shower, like washed my hair, and then crawled into bed all cozy. And it was the most relaxing immediate after birth experience compared to being in the hospital. It was just so peaceful. So
I think
peaceful.
that's the big thing, right? Like you're in your own space and
Yes.
immediately.
Huge. It was huge. I think the midwives finally left around 2 a.m. after, trying to get him to latch and trying to get everything settled and make sure, because they want to make sure baby's doing okay, right? I remember even texting you because I was on antidepressants, remember? And I was like, can I take these and still have a home birth? Because I guess there's some concerns around the breathing after. So, but it was fine and everything was fine. And he was great. But it's just being in your own environment, even having your own like shampoo and conditioner and body wash,
Like
and,
all the little things.
all the little things. It was so cozy. And then it was finally ready for them to pack up. And Mike was so confused. He's like, you're leaving.
He's like, you don't stay for the next 48 hours?
You're not staying overnight. Like you're just leaving us with this baby. Like
you're like, I got this.
I was like, it's fine. We're good. But yeah, I didn't even sleep that night. He passed out cold and we didn't have a name. We had nothing. Like it was so different than what you'd think, right? But it was so beautiful. It was just such an amazing experience. Our next one, like little concerned how fast that birth's gonna go.
Right. I was just thinking that it's a good thing you had a home birth.
Yeah.
Because you guys are way out. You're quite far from the hospital, right?
Yeah. I mean, we're at least a 30-minute drive, like, and that's kicking it, like going quite quickly to the hospital. There was a point where I was like in labor. I'm like, I can't do this. And they're like, well, we can call an ambulance, but you're going to have it in the ambulance. So
yeah. And I think I think that many of us, when we're giving birth, go through that, like that thought pattern of like, oh, I can't do this, because it is almost an out of body experience, right?
It is so out of body. And anyone that knows me, like all of my friends, I mean, Mike, my partner, can attest, I am quite dramatic of a person. And I just remember being in the tub and the pain, and they're like, well, no, you can't go, like, we're not going to the hospital. Like, you can do this. And I just remember like submerging my head underwater. And I'm like, well, I'll just take myself out of this picture then. Like, let me just drown myself. You guys get the baby out. And they're like, why does she keep putting her head in water? So I'm just like this sopping wet mess trying to like stop this pain. But man, what an experience.
Oh, right. So can you tell us a little bit about what your postpartum experience was like?
Yeah. So, I mean, being a second time mom, obviously you have a little bit more knowledge. With Ryder not being able to feed properly, I was quite determined to try and make this work with Rome. He was feeding really good, latched right away, was quite a good eater. And then with me, I, for some reason, always get mastitis. With Ryder, I had it 3 times and like got very sick because of it. And then I just remember waking up and the immense amount of pain I had. I was like, this is mastitis again. And my one breast had my milk supply totally dried up. And Rome was just not happy. I think my milk was diminishing. And I remember sitting at the end of my bed talking to my midwife, and they were like, if you want to push through this, we are totally here and we're going to push through it with you. But there's no shame in, just stopping. Like, you need to listen to your body and what you can mentally do. And like with me, I mean, my background, but my background is total mental health and psych and everything. So I was like, okay, let me try this for another 24 hours and we'll see. Like give a time span of what I can allow myself to do. And then at the end of that 24 hours, my baby was like another baby. I don't think I was producing anything. I remember having a formula bottle in the pantry, thank goodness, on hand. And I shoved it in his mouth and he chugged it. Like this baby was starving. And then he just passed out. And I was like, oh my gosh, like that's it. I'm not producing. He's so hungry. And I called them and I'm like, like, he's happy on formula. My milk is just not doing this. And like, what's risking postpartum depression? What's like risking postpartum anxiety? Like this baby just needs a happy, content mom, and he needs a happy and content belly. So formula it was, and he's been happy ever since. And, we gave it a week. Do I wish I probably would have given it longer? Absolutely. You always have that, like, what if? But, at the end of the day, my sanity was way more important. And I think I even had like a tad bit of postpartum. It's hard to tell because I have seasonal affective disorder anyway. So like going into, he was born in July, summer was great, but then like going into the winter months, we kind of just like dipped and hibernated, and I was pretty unmotivated, pretty lethargic, just sleepy. But yeah, you just got to listen to your body, and you have to like everything else at the window, what you're supposed to do, what like social norm is. It's all about don't push yourself, like it's crazy.
Oh, it's such an important message. And I'm so glad you're sharing it, because we try and sacrifice so much of ourselves, right? When you're trying to care for our newborns and think that you're doing the right thing. But if you're not present and you're not mentally in a good space, that's not good for your baby either.
No. Yeah, absolutely. 100% agree. Like we sacrifice so much. And after we've just gone through birth, like, and I don't think anyone really talks about how even traumatic that can be, like mentally, physically, like even spiritually in your body, how much we give during birth. And then now we're expected to care for and keep this tiny human alive and give everything to. And it's just making sure that like you're fed, and even looking back, like, second baby, you think you got it, and you think everything's going to be prepared. Like, I don't think I ate for 24 hours, wasn't nourished, like that diminishes milk supply, all these things that you don't think about. And I'm like, probably should have eaten, probably should have been hydrated. But if you don't have, that mindset, or, even like, a postpartum doula was so important sometimes for things like just basically bringing you prepped food, because your nutrition and your even hydration is the last thing you're thinking of. But it starts with you and it ends with you for making this baby and keeping it alive and, all that kind of good stuff. So we definitely got to give credit to all the mamas and how much we go through, right?
Oh, it just changes you so much.
So much. Yeah.
I wouldn't change it for the world, but it's definitely the hardest thing I've ever done. And I've done lots of hard things.
Absolutely. I can totally agree. Even, I mean, he's 9 months and he even still tests me all the time. My 6-year-old still tests me to this day, but we love them. And yeah, it was just 2 totally different birth experiences, 2 totally different outcomes. And yeah, I'm actually really grateful for the contrast, because it gives me such knowledge on both sides.
Yeah. No,
yeah, super cool.
Thank you so much for sharing it with us.
Absolutely. I'm so happy to do this with you.
Oh, me too. Well, it's just nice to chat with you and see you on Zoom. The podcast.
I know.
And I'm really grateful you were able to share so honestly about both your experiences, not only with your births and how they were different, but postpartum and how hard it.
Yeah, absolutely. Yeah, we need to talk about postpartum way more than we do, because, I think coming out in this day and age, there's a lot more talk about, postpartum and things that we can do, and coping and anxiety and depression, but there's always room for more talk about it, because there's so much still that needs to be normalized in terms of, feelings that moms go through, and that detachment that can happen, and, that instant connection may not be there, but it's not going to stop the love for your baby long term.
No, exactly. Oh, it's such an important message. Thank you so much, Cait.
Thank you.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found. found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.